A quick bedside neurological exam should be performed by a nurse in various situations to assess a patient's neurological status and detect any potential abnormalities. Some common situations where a nurse should consider conducting a quick bedside neurological exam include when a patient is admitted. Performing a baseline neurological assessment can help establish their normal neurological function for future comparison. If a patient experiences a sudden change in consciousness, behavior, or neurological symptoms, such as weakness, numbness, or difficulty speaking, a quick neuro exam can help identify potential causes. After surgery, especially procedures involving the nervous system, a neuro exam can help monitor for any neurological deficits or complications. Patients who have experienced head trauma, even if seemingly minor, should undergo a neuro exam to rule out any intracranial findings or concussions. Patients suspected of having a stroke or transient ischemic attack should receive an immediate neuro assessment, such as FAST, to evaluate the extent of the neurological deficits. After a seizure episode, a neuro exam can help determine the patient's level of consciousness and assess any focal neurological deficits. Certain medications can affect neurological function as well. Performing a neuro exam before and after administering these medications helps monitor their impact. Patients under sedation or anesthesia should have regular neurological assessments to ensure they are recovering safely. Patients with chronic neurological conditions, such as multiple sclerosis or Parkinson's disease, may require routine neuro assessments to monitor disease progression. For patients in critical care or those with compromised neurological status, regular neuro exams can help identify changes in neurological function over time. Before discharging a patient, especially those with neurological deficits, a final neuro exam can ensure that they are safe to leave the facility. It is important to note that the specific timing and frequency of conducting a quick bedside neuro exam can vary based on the patient's condition, medical history, and the healthcare setting. Throughout your assessment and interaction with the patient, assess the speech, note whether articulation is clear and understandable, the pattern is fluent and even, and the content is appropriate. Delirium screening should be included as part of the quick bedside neuro exam. Select a validated tool to perform this assessment. Here is an example. Perform hand hygiene while entering the patient's room.
Good afternoon. My name is Maria Damian. I'm a nurse here at the Satoko Hospital. So I'm going to start off by asking you for your full name and your date of birth, and I'm just going to check your bracelet while I'm doing that. Can you just tell me your full name?
Aaron Charles Half Kennedy.
Okay.
347.
Okay, thank you very much. So you can call me Maria throughout the assessment. How do I call you?
Aaron.
Aaron. And my pronouns are she and her. What are your pronouns?
He and him.
Okay, thank you.
Ensure you have the patient's consent before you begin.
Now I'm going to just explain what I'm going to do. So I'm going to do a really brief neurological assessment, and I'm also going to ask you some questions. Again, if you feel uncomfortable at any point, just let me know and we'll skip over that or stop entirely. Do I have your consent to continue?
Yes.
Assess your patient's level of consciousness and orientation.
Now I'm basically looking at your level of alertness. You're fully awake. You had your eyes open when I entered the room. And I'm going to ask you some questions, okay? So where are you right now?
McGill Hospital.
Okay. And what is the date today?
October 23,
And the year?
2023.
Thank you. And who's the Prime Minister?
Justin Trudeau.
Okay. And what is my name?
Maria.
Thank you very much.
Your patient's vital signs were likely taken before this. Next, use a pen light or an otoscope to check the pupil's size, shape, constriction, and accommodation.
Okay. And just look at my nose, okay? Look over here. I'm going to shine a light in your eyes. Okay. Okay. So now I'm going to ask you just to look at my finger and just follow my finger. Okay.
Next, assess your patient's speech.
So I'm going to ask you to say light, tight, dynamite.
Light, tight, dynamite.
Can you say it a little bit louder?
Light, tight, dynamite.
Okay, thank you very much.
Next, assess for any facial weakness.
So I just want you to lift your eyebrows, okay? Frown as if you're really upset, okay? Can you puff your cheeks? Okay, and show me a big smile. Okay, and next I want you to say ah, and stick out your tongue, okay? And move it from side to side, okay? Up and down. Okay, thank you very much. Now move against my hand over here, okay? And over here.
Ensure facial movements are equal and symmetrical.
Lift your shoulders, please. Okay, thank you very much.
Ask your patient about their ability to swallow.
So, Erin, I'm wondering, have you had any difficulty with swallowing over the past few weeks?
No.
No. Do you ever need to clear your throat as you're eating?
No.
No. Are you coughing when you eat ever?
No.
And have you noticed any kind of drooling as you're eating or
No.
any wet voice after you've been eating for a while?
What?
Like your voice sounding wet.
I don't know that experience, so I have to say no, I don't believe it.
Okay. Thank you very much.
Next, test the strength in the upper and lower limbs.
So now what I'm going to ask you to do is go like this, and push against me. Okay, and pull me towards you. Perfect. Now I'm going to ask you to grip my fingers as tight as you can. Tight, 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 tight. Okay, and now let go. Wonderful. Now I'm going to ask you to hold out your arms like this, as if you're holding a big pizza box.
Assess for pronator drift.
And close your eyes, please. Okay, thank you very much. I'm gonna uncover you. So I'm gonna take off the blanket, okay? And just bend your knees, okay? I want you to push against me by bending, yeah. And now flex again here, and now pull me towards you. Okay, thank you very much. Now push on the gas pedal, okay? And point your toes up. Okay. Thank you very much.
If situation permits, ask your patient to stand up and walk 6 meters to assess their gait.
So I'm gonna ask you to actually stand up, and you're gonna walk from over here all the way to the end of the bed, okay? So I'm just gonna ask you, wonderful. So back up all the way to here, okay? So just walk towards here and then back.
Assess for smooth, even, and coordinated movements.
And walk back. Okay, and now I'm just going to ask you to sit back in your bed.
Lastly, ask your patient a few questions to find out about associated symptoms and rule out red flags.
Just to wrap up, thank you. The physical exam is done now. So first, I'm wondering, have you had any strange or like really severe headaches over the past couple of days or weeks?
No.
Have you had any neck stiffness or rigidity or neck pain?
No.
Any numbness?
No.
No. Have you noticed a fever in the past few days?
No.
Okay. Have you had any unusual blackouts or loss of consciousness?
No.
No. And have you noticed any sudden change in your strength on one side of the body?
No.
What about your face?
Strength?
Yes, like kind of like a weakness
No.
or droopiness on one side of the face.
No.
No? Okay. Thank you. And last but not least, have you noticed any vision changes?
No.
Like sudden double vision, difficulty seeing?
No.
Okay, thank you. So Aaron, that concludes everything. So I'm just gonna ask you to lie back down in bed. Okay. I'm just going to raise the rail, and I wanted to let you know if anything changes, if there's new symptoms or you need something, you can always ring the call bell. Okay?
Okay.
You can just press here, and then there's a light that's going to go on at the nursing station, and we'll come see you. Thank
Okay.
you.